This is my view out the window of my hotel. Here's the Empire State Building, getting ready for another day. I have 27 years of service. I've been on 4 deployments, all of the medical missions.
Colonel Edward Ramirez never expected his next deployment to take him here, to New York City, in what became the front line of the nation's COVID-19 response.
Here we are at Lincoln Hospital. It's not missiles or bombs, but the threat to life is just as much, if not more.
Just back from a months-long deployment in Kuwait, he kissed his family goodbye and boarded a cross-country flight, reporting for duty in the hard-hit Bronx.
What we're going to do is take this here, make a head cover. The difference for us is when you're a physician, you're not on the very front of the war. Here, we're the infantry.
As cases skyrocket throughout the country, currently at least 38 states seeing an upward trend in cases, tonight we meet 4 heroes in uniform who answered the call from a city in crisis.
You know you're putting your life on the line.
That's what we do, man.
Combat medics deployed to the epicenter of a new kind of war.
Nothing truly prepared us for what we came here for.
Now carrying the scars of a hard-fought battle, ready and willing to answer the call of duty yet again.
I think I was expecting that we could walk in and be able to fix everyone. We couldn't.
New York's first case of coronavirus affected a 39-year-old healthcare worker who had
While officials say the threat of coronavirus remains low, they have told Americans to get ready for the unknown.
Governor Cuomo warning that this is just the beginning and to expect dozens and dozens of more cases.
It's impossible to imagine how quickly this moved. Our hospitals could be overwhelmed in a matter of weeks.
The last 24 hours have been very, very sobering.
As the days ticked forward and the numbers climbed, New York City Mayor Bill de Blasio made an urgent plea for help.
We are 2 weeks or 3 weeks away from running out of the supplies we need most.
The city bracing for a mounting death toll. More than 1,200 lives.
It's time now to declare a state of emergency in New York City. This has been like war. You either had to find a way to survive or you would be overrun. And we were talking about people's lives.
And so how did you call for reinforcements? How do you literally call in the cavalry?
I said, we are running out of people. Can we turn to the military medical personnel on duty right now all over the country and bring them to the front, the epicenter, New York City? Can we do that?
Within weeks, the federal government, working with the state, would send thousands of troops to New York City.
The Army Corps of Engineers will build makeshift hospitals at 4 locations, including the Javits Center in Manhattan.
All of this to help alleviate the strain on medical workers and hospitals in the city treating coronavirus.
What was it like getting that deployment call?
Well, at the time when I got it, I was actually getting my hair done. My commander was like, I need you tomorrow.
At home in Texas, Major Angela Murphy sprang into action.
I was calling my parents. I was like, do you have my power of attorney? Like, if something happens, like, I want to make sure everything is squared away.
You actually thought you might not make it back.
Right. Because we were going to New York City. We had already heard reports of, like, healthcare workers dying.
This deployment, a world apart from her last mission at Bagram Air Force Base in Afghanistan.
Were you more nervous about going to Afghanistan or going to the hot zone of New York?
With Bagram, I got 6 months of prep time. Here, we had like 16 hours, and then we were there.
There are now, on average, a dozen coronavirus deaths every hour here in New York City.
More than 1,500 New Yorkers dying from the virus this weekend alone.
Mayor Bill de Blasio braced for what he called a huge surge in infections.
I've been in New York City before. The minute we got in there was no traffic. It was kind of eerie. It was kind of weird.
Major Murphy was deployed to the emergency department at Lincoln Hospital in the Bronx. This borough, home to the highest rates of COVID-19 deaths and hospitalizations in all of New York City.
When did the anxiety hit?
It hit the first day we were at Lincoln. Just to see the amount of critically ill patients, rooms turned into ICU beds. It was like back to back to back.
Compared to Bagram, it sounds like it was a mass casualty event 24/7, 7 days a week.
Correct. Every moment of every shift, every day for weeks. It's overwhelming. Sometimes you just want to duck off and like just cry. But, you can't do that right now because you have other things, to do. And so
you soldier on.
Right.
Just a few miles away in Queens, Major Esther Cleggs-Burns and Commander Thomas Shue were dispatched to Elmhurst Hospital. Early on, one of the hardest hit areas in the city.
We're here to help relieve their staff who had been on it since, the very beginning.
I love y'all. I really do. When we got to the hospital the first day, we had a meeting with the administration. There was literally shouting in the room from excitement and joy about what we were bringing to the table. Hi, Mama. Hey, baby.
But for Major Cleggs-Burns, the call to duty meant leaving behind 2 young daughters and her husband back home in Alabama.
My baby, she's 1, so she doesn't even realize I'm gone. Hey, girl. My oldest, she's 6, so she's having a little more difficult time. Give me sugar. I don't think military spouses get the credit that they deserve. My husband can't go to work because childcare is closed, school is closed. He's at home taking care of our girls. My husband, he is rocking it.
Say bye-bye. Bye-bye.
Elmhurst, I got my team in front of me.
With 28 years in the Navy under his belt, Commander Shue has provided life-saving care around the globe. But the front line of COVID, he says, was entirely different.
If you are injured on the battlefield or have a combat casualty, and we could get you to medical care within that golden hour, you had about a 96% survival rate. That really is different here. When you're intubated, the mortality rates kind of skyrocket.
By the end of April,
we are in fact on the downside of the mountain.
The curve appeared to be flattening.
Overall hospitalization rate is down. The number of intubations.
The situation in New York appeared to be stabilizing.
21 days of hell, but we're back to where we were.
The worst-hit hospitals were finally seeing fewer patients. But what remained? A grateful city. Those cheers for frontline workers still echoed each night at 7 p.m.
It's an incredible thing to hear how appreciative everybody is. Yesterday was my last day in the hospital at Lincoln. My clinic gave me an applause. Which was from the heart.
I'm so happy we're all headed home.
And as quickly as they arrived, it became time to leave. Before departing, Major Murphy and a few dozen others honored in a special ceremony at Lincoln Hospital.
You left your families, you left your jobs. We're a better hospital because of it.
The toll in the U.S. now more than 130,000. A list of names that has continued to grow since this May New York Times cover.
I bought the paper the day before I left, so I would have it.
And did you
But I wouldn't look through the names. I wouldn't look through the names. I didn't want to see a name I recognized. One day I'll pick it up and maybe I'll read it, or maybe I'll just keep it how it is.
If there were a second wave, would you answer the call again?
Yes, I would. I couldn't not, you know what I mean? It's just too hard for me to say no when your country needs you.
And for Colonel Ramirez, after so many deployments and so many months away in the past year, this return home is an opportunity to make up for lost time.
I missed my wife's birthday, I missed Thanksgiving, I missed Christmas, missed New Year's. I missed all the important days of our life, so to speak.
When Colonel Ramirez finally returned home to California, There to greet him, his wife of 35 years.
We made it.
And like a truly dedicated husband, he managed to bring flowers all the way from New York.
This is what I wanted to be in the military for, to be of service to my country. I know that if I had not deployed, I would have regretted it.
Welcome home.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.